So polycythemia vera is actually chronic myeloproliferative neoplasms, and 95% almost studies showing that 90 to 95% patient population actually have JAK mutation in it, and then again other four has like JAK B16F and other mutations. So our main goal was that to assess that how GLP-1 receptor agonist can implement. So as a resident who know the FDA indication for GLP-1 receptor agonist that usually used for patient for the weight management, type 2 diabetes mellitus, and some recent evidence showing that it might be helpful in heart failure exacerbation, and might be a part of GDMT trial as well, like guideline directed medical therapy for heart failure exacerbation. So I think they are showing very promising results in the other field. But when prescribing some of my patients and in the clinic as well, after seeing that there are some patients in MDS as well as patients from polycythemia vera, when we were seeing them, we saw some good clinical outcomes as compared to those who are not. So in order to further solidify our research, when I dig down deeper into their translational perspective, found out that the GLP-1 receptor agonist has potential anti-neoplastic and anti-inflammatory activity. There are some preclinical evidence showing that those type 2 diabetes mellitus patient on GLP-1 receptor agonist has less likely chance to develop MDS and myeloproliferative neoplasms, both in type 2 diabetes mellitus and autoimmune disorders as well. So when we were digging deeper into the field itself, that what is the main cause that making it less likely to develop these kind of tumors and cancers. So GLP-1 receptor agonist has potential anti-neoplastic and have anti-inflammatory activity as well, given the fact that it actually modulates and inhibit PI3K mTOR pathways, then it modulates MAPK and ERK pathways as well. And furthermore, there is preclinical evidence as well that it stabilizes JAK-STAT pathway as well and prevent STAT dimerization and everything. So after getting this knowledge and after getting this information, we wanted to implement that on our patients as well. But still, GLP-1 receptor agonists were never been explored in patients with polycythemia vera. So after seeing the clinical findings in our patients, we wanted to implement that into a broader audience. So we took a large database, and we definitely want to acknowledge Trinitex database as well. We used the Trinitex database and pick up patients from 2010 to 2022 diagnosed with polycythemia vera. And then we did the propensity score matching, 1:1 propensity score matching based on their 45 to 50 categories, including their age, gender, ethnicity, all their demographics, then all the other comorbidities which can impact the mortality. For example, we wanted to be very thorough. So we included each and every comorbidity which can be a part of a propensity score matching. Then the medications which can implement that, for example, aspirin, insulin, statins majorly decreases the mortality. So all the antilipidemic agents, including statin, ezetimibe, PCSK9 inhibitors. And then if they have diabetes, how well controlled was it? So we also put some laboratory parameters in it, like mean HbA1c levels, and so that if we have a propensity score matching, how well their diabetes was controlled or not. So we wanted to be very thorough in our propensity score matching. So we used propensity score matching and used greedy nearest neighbor method with a caliper of 0.1 standardized mean difference. And based on that, if it's less than 0.1, then we found it to be effective, matched properly with less confounding. So we wanted to be very thorough and included all the confounders as much as we can. Then we follow these patients from the index event, which include polycythemia vera diagnosis, and the patient started taking GLP-1 agonists till 3 years. So at the end of the 3 year, we found a very promising results that our primary outcomes included were all-cause mortality from any cause, then our progression to myelofibrosis, then we have venous thromboembolism, and our secondary outcomes included the healthcare burden, like all-cause hospitalization, all-cause ICU admissions, and also AKIs, acute kidney injury. So why we put that particular parameters, as we know that polycythemia vera, almost 34 to 48% patient population usually develop venous thromboembolism, which I mean pulmonary embolism as well as DVTs and all the other clots. And on top of it also develop acute ischemic stroke or TIAs as well. And then almost 10 to 14% patient population can progress to myelofibrosis. And studies have shown that almost 3 to 4% patient do have a leukemic transformation as well. So we wanted to include those as the primary parameters. So at the end of the 3 years, we found out that those patients who were on GLP-1 receptor agonists versus those who are not had low or lower odds of developing having all-cause mortality, AKI, progression to myelofibrosis, all-cause ICU admissions, and also, as well as all-cause hospitalization. So and even the healthcare burden was coming down as well, and as well as decreased chances of having TIAs as well. So all the parameters, both in primary and secondary outcomes, was statistically significant decrease in those patients who are on GLP-1 receptor agonists versus those who are not. So I think like so that was kind of a really promising result. So in order to further solidify our study, we did the subgroup analysis taking type 2 diabetes mellitus only patient, that the diabetes is not a major confounding playing here, even though we put that diabetes in our core propensity score matching. We took only type 2 diabetes mellitus patient, did the same analysis on them who were taking GLP-1 receptor agonists, compared it with metformin. The diabetes control is playing here a role, but we in the same cohort as well, we found a very promising result that GLP-1 receptor agonist has decreased odds of having all these outcomes versus those who are on metformin. So now I think like what next? That might be the question. So I think like now we are moving towards because we do have some limitations given the fact the study was a retrospective cohort study, so you can't put it as a causality. There are some other limitations from the database as well, that there might be some miscoding bias as well and misdiagnosis bias as well. And there might be some ascertainment bias given the fact those incorporations, because we have the data from 147 healthcare organizations in our study, it might be possible that the patient is not following up there or maybe switch any organization, so we might lost their data as well. So there were some limitations and lack of clinical granularity. We do know that 45 to 50% patient population in our cohort had JAK mutation, but we're not sure about the other 45%. So, and we don't want to see that they might have it or they might don't have it because we don't have their data there. So I think there were some couple of limitations there as well. But in our study, it's found out that those patients who take polycythemia vera patient taking GLP-1 receptor agonist has decreased odds of all these primary as well as secondary outcomes versus those who don't. And obviously further randomized control trials are needed to check the safety and efficacy of GLP-1 receptor agonists in polycythemia vera patients. And now we are moving next. We also did the same analysis on MDS and found some very promising results, because in the end the concept is same, that the chronic inflammation causing somatic mutations are getting decreased if you put a synergistic effect of GLP-1 receptor agonists and what other medication or other PV or MDS directed therapy you are using. And I think like now we are moving towards more translational approach in which at Dr. Massachusetts lab, specifically for the MDS, we are grafting the mice with low risk MDS mice and then seeing the trends. And that's what our next step is actually. You're going to graft the mice with the high versus low risk MDS as well as and infuse the GLP-1 receptor agonist in them and see the clonal evolution burden over time.